Professor Karol Sikora, the 2-metre rule is like a religion, frankly. Why are we following the wrong rule, in your opinion?
Well, there is no right or wrong rule. There's not much science behind all this. That's the trouble. The WHO recommendation, and I worked with them for 2 years some time back, is 1 metre, and that's the sort of world standard. Another metre was added for safety, and that was probably the right decision at the beginning of all this. But realistically, if you think, OK, there's only so many jobs where people can work from home. Some people have to go into work and have been going into work. It's fantastic. The distributed trade has carried out. The food chain is great. So we've got to work out what's realistic. To make it 2 metres is a huge challenge in the workplace.
It might not, but sorry, Professor Sikora, it might not be realistic within the workplace. We were talking to Aldo Zilli earlier, talking about restaurants and kitchens and how tightly packed you are in there. But if it's keeping people safe and it's keeping that R rate below 1, surely it's hugely important.
It's hugely important, but, you know, we don't know. And there's no scientific base. I mean, you know, I'm an oncologist, so I specialize in cancer treatment. The way we use our drugs, the way we do investigations has a base in science, but this has nothing. And the politicians are lost because they get conflicted. WHO saying 1 metre, other people say 5 metres. That would be what you'd have to do if you really want to make sure. And that's really not feasible. We'll never get back to work at 5 metres. So we've got to get a balance right.
It's so interesting you say that, because we're told all the time, Professor Sikora, that we're following the science.
There is no science about the separation. There are some studies on droplet spread from people that have been done over the past, but they're not conclusive. And the problem about this, if we have various things, if we have lockdown, if we have an app to identify people that have infection and people obey it, which they have done. British society has been tremendous about obeying the rules of lockdown without any force being applied. And if we can continue to do that and people self-isolate if they have symptoms, then there'll be no problem. But workplaces do need some form of closeness together, not less than 1 metre, but certainly less than 2 metres. It's not feasible to adapt workplaces.
Paul, you've just heard Professor Sikora there saying that we don't need to worry about this 2 metre rule. There's no science behind it. 1 metre should be plenty. Would that fill you with the confidence to turn around to your union members and say, look, we're safe to go back to work, let's get started, we need to get things up and running?
I don't think it'd fill me with confidence. I don't think it'd fill millions of workers with confidence either. I think if there was going to be any change at all to the 2 metre rule, it needs to be properly explained to people, and people will have to understand why the government had changed their view. But, you know, the key thing is that there aren't millions of people at work at the moment. We want to see other people return to work, but we want to see them return to work in a safe way. Now, the key way of doing that is ensuring that every employer meets their legal obligation to carry out a risk assessment. And that risk assessment should also think about how people can maintain the social distancing, but also other measures to keep people safe at work. You know, crucially, lots of people are anxious and worried about the impact on their health, worried about the impact potentially of bringing things back to their family and friends. So let's get people back to work, but let's give them the confidence that when they go to work, that everything is being done to make work as safe as possible.
So, suggested guidance: stagger shift patterns to reduce numbers at work at any one time, separate entrances and exits, and do one-way routes through buildings, sanitising facilities at entrances, no security keypads. I mean, one of the things that I think people are wondering about is if you're in an office block with plenty of floors, how on earth do you use a lift? There's lots of people. You wouldn't even probably, in some cases, want to get into a lift with one other person, let alone the crowded lifts that we're often used to. Having looked at what you think the guidance might be, what do you think the problems are going to be, and what sort of guarantees can possibly be provided?
Well, we looked at the draft guidance on Sunday, and for us, Susanna, it's just got far too many holes in it at the moment. To give you one example, there is currently no section on protective equipment. Now, I don't think the government could expect employers or unions to agree to guidance when we don't know what it says about the key issue that many workers will be worried about, which is protective equipment. And again, for me, the key thing about protective equipment and indeed all of these other issues you've raised in terms of things like getting access into the building, lifts and so on, is that employees should carry out a risk assessment, and from that risk assessment decide how best to keep people safe. Now,
When you say
if
protective
people
equipment,
require protective equipment, that needs to be supplied to them.
yeah. I mean, there's a massive issue over protective equipment, isn't there? Because we know that it hasn't even, in all cases, got to those who need it first, the care workers and the NHS workers. It's going to be a challenge, isn't it, for employers to be able to get enough protective equipment for their employees when we're all trying to prioritise those on the front line.
Well, absolutely. But this is where I think if a risk assessment says that people require protective equipment, employers will have to provide that protective equipment, and government will have to step up to the plate in terms of supply, not just in health and social care, but in factories, in offices and other work environments. And I don't think it would be fair or right to say to somebody, we've assessed the risk, we feel in order for you to carry out this job safely, you're going to need protective equipment, but we can't provide it, so therefore, sorry, you'll just have to come into work anyway. So, we've had 6 weeks of this lockdown now where many people's jobs and livelihoods have been placed at risk. We've lost thousands of people, thousands of others seriously ill. I think it's right the government is talking about a return to work, but they've got to do it in the right way. Let's get this guidance right. Let's take our time and let's make sure we give people confidence that they can go to work safely.
Yeah,
I mean, we haven't even talked about things like public transport, people having access to schools to support their children. These are all the things the government needs to get right.
We have been running a Twitter poll actually here, Paul, with our viewers about what are their highest concerns about going back to work, and it is the commuting that is really fearing for them. They're concerned about 11.9%. Distancing at work is concerned, contracting the virus at work, the risk of infecting the family as well. And Professor Sikora, of course, that is a major factor. As Paul's saying, we've taken 6 weeks to get here. We've managed to squash the curve, as the Prime Minister and the government have been banging on about. We've managed to prove that we can help our NHS and we can protect the A&E departments and the critical care departments. If we rushed back to work now, and the factors and the things aren't in place to make sure we can stay safe and the confidence isn't there, surely all that hard work could be wasted.
Absolutely. And we've got a lot to learn from other countries. So in Austria, they came out of lockdown, strict lockdown, on the 14th of April. So they're well ahead on the curve. Of course, their pandemic was ahead of ours. So, but we can learn from them. And they're a wonderful country for monitoring apps and testing and so on. So we can learn from that. We have to follow what happens very precisely, whatever we do. And you're right, it's the commute that's the worry. It's going to be difficult on the tube line in London and in other parts of the country on buses and railways to actually separate people at the peak of the rush. So even though probably 30% of the workforce will work from home and still carry on doing that, or partially work from home, maybe going in just 1 day a week, the commute is going to be the big problem. And it only affects certain people. Not everybody commutes in public transport. So the car drivers are much safer, I guess. And the families, it's not just you, it's wherever you live, there are other people in that house. And so we've just got to monitor everything really carefully. And testing's not been one of the triumphs over the last month. So we've got to get our act together on that.
Yeah. Paul Nowak, would you want an expansion of testing? And what is your view on whether face masks would be one thing to encourage people back to work?
Well, I think an expansion of testing and putting in place an effective tracing system is obviously part of the solution. I'm not medically qualified to make the call on face masks, Susanna. I'd go back to the broader issue, though, about protective equipment. And all of this, to me, comes down to rooting our actions in proper risk assessments. Every employer's got a legal obligation to carry out those risk assessments. We're calling on the government to go further, to give customers, staff, the public confidence that employers are doing the right thing. We want employers who produce risk assessments to have to publish those risk assessments, and for them to publish them on a government website as well, so we can all see that employers are doing the right thing.